Once the diagnosis of breast cancer is made on a biopsy, the next step is to determine whether surgery should be performed, and if so, what kind of operation. Most often, breast cancers are detected when they're still relatively small. In that situation, we begin with surgery first. And surgery for breast cancer can mean either just removing the lump in the breast, we call that a lumpectomy or a segmental excision, or performing a mastectomy, which is removal of the entire breast tissue. After surgery, other treatments will be indicated based on the type of cells that are in that tumor. Sometimes we use hormonal therapy, sometimes we use chemotherapy or biologic treatments, and we also use radiation therapy. Let me just first talk about radiation therapy for a moment. When we do a lumpectomy, in order to conserve the breast, that always is followed by radiation therapy. And we have more and more data now from clinical trials that tell us that using radiation therapy after lumpectomy for early stage breast cancer not only cuts down on the likelihood of a recurrence in the breast, but also helps in terms of curing more women and prolonging survival. So radiation treatments are a very important part of therapy after a lumpectomy. In some situations, even if you've had a mastectomy, we might still recommend radiation. Part of the surgical evaluation of breast cancer is not only removing the lump, but checking for the lymph nodes under the arm. There are several different ways that we can do that. Until recently, most women had to have a complete dissection or surgical removal of many lymph nodes from under the arm. We now use a technique called the sentinel lymph node biopsy. And in this technique, surgeons can look at the very first lymph node that drains the breast tissue to see if there are any microscopic cells. If there are no cells in the sentinel node, then we don't have to go on to remove more of the lymph nodes. And this saves women from having bigger operations, and it also means fewer complications after surgery. If we see cells in that sentinel node, then we have to discuss whether or not more surgery is indicated to look at the rest of the lymph nodes more closely.